Okay, thank you. Please take your seats if you don't mind. I hope you all managed to meet somebody new over the lunch break. Okay, I think we'll get started. This is a very difficult session to be the chair of and to be running. Dr. Majid has already said we should change the name of this session to the food coma session, not the food use session. The purpose of this session really is around food use. It's around what happens to food post-production and importation into Saudi Arabia. What's our regulations, distribution, consumption, disposable, reuse, and identify the most critical sustainability challenges. We've already heard of some significant sustainability challenges around food and water, food production and water production. This is around the use of food in the kingdom. We'll follow again the same pattern as previous sessions. We have an eminent chair, and then we have some specialist speakers to support the chair in presenting us the information that we need to understand the issues. To lead us in this discussion, it is my great pleasure to introduce to you Dr. Majid Al-Khalaf. He is the Acting Executive Director of Monitoring and Risk Assessment. He is also the Secretary General of the National Nutrition Committee, Saudi Food and Drug Authority, and is the Director of the same committee. He holds several positions in the SFDA, including Chief Specialist and Senior Dietitian, and he has many other senior roles and experience that is listed on his bio in the program, if you want to follow that up. So if I can invite you to the stage, please, Dr. Majid, and you can, and also all of the speakers, if they could come to the stage, and you can present to us all of these issues relating to food use. Thank you very much.
Good afternoon, everybody. Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah, alhamdulillah, salatu salam ala Rasulullah. Excellencies, ladies and gentlemen, assalamu alaikum. It's my great pleasure to chair for this food use session in KAUST University, which titled in Workshop for Sustainable Food Security. We are very grateful to the organizing committee for this workshop for their support and hosting this precious event. Particularly Professor Rodwing and also Professor Mark Testa and also Rebecca for their help and support for their hosting and supporting for this event. The main aim of this session is to gather evidence and develop a framework in supporting of a national agenda for sustainable food security, specifically related to the issue of food use in the Kingdom of Saudi Arabia, by defining the challenging facing food utilization in KSA and developing solutions to address food utilization challenges inside Saudi Arabia. Sorry. I want to draw your attention first to the concept of food security and food utilization to understand the challenges and the main pillars of food security. Food security as defined at the World Food Summit Plan of Action as a state in which all people at all times have physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. The four basic pillars of food security are availability, accessibility, utilization, and finally, stability. Kindly, I would like to remind my speakers to strictly stick with the time. It is 7 minutes as is scheduled. And I sincerely hope you will enjoy today's session. And thank you so much for your participation and listening. In the first presentation, I would like to introduce Dr. Yara Al-Muhtadi. Dr. Yara, she's Assistant Professor of Nutrition and Behavioral Sciences from King Saud University and Head of Scientific Awareness team in the National Nutrition Committee, which I'm interested on mass media. Also, Dr. Yara has hosted 2 podcasts on nutrition and wellness in collaboration with independent in Saudi Arabia. Research interests include obesity management, behavior change, and also program evaluation. She will talk about using awareness programs to tackle food waste problems in Saudi Arabia. Dr. Yara, the floor is yours.
Thank you. Thank you. Hello, good afternoon, everyone. I hope you've enjoyed your lunch. Thank you, Dr. Majid, for your introduction. Thank you, KAUST. Thank you, Rebecca, for organizing this. It's such an honor to be here today. So our presentation, let's start. We only have 7 minutes, so I'm going to try to be quick. So, perfect. So today I'm going to be talking about understanding food waste challenges in Saudi Arabia. This is the outline for today's session. Why should we care about food waste? Why is it now really a very challenging topic, and at the same time it's alarming? Because it is estimated that 811 million people were hungry in 2020, with a staggering 3 billion people can't afford a healthy diet. It is also because of this, unfortunately, food waste has only gained public attention after acknowledgement by the UN as a sustainable development goal target. Also, it is a key topic on the G20 agenda. As you can see from the food waste index, that around 931 million tons of food waste were generated in 2019. 61%, or the majority, came from households. This is where we're going to be focusing on today. According to the food waste ratio in Saudi Arabia, it was 18.9%. This is in 2016. We're thinking where the numbers have already grown up, definitely. Total waste, according to consumer spending, was around 40 million Saudi riyal. Again, this is in 2016. Here, I'm introducing an interesting study that was done in 2021 by Al-Thmeri, and it is the first national study to assess the relationship between food waste and food insecurity in Saudi Arabia. So they have interesting results. As you can see, the numbers are going up here. They found that the weight prevalence of uncooked food waste in the last 4 weeks was 63.6% and 74.4% for the cooked food waste. So this is alarming. Why do you think we should reduce food waste? Because it improves food sustainability, accessibility, as well as availability. Also, it will help address climate change, saves all the money, and reduce pressure on land, water, and biodiversity. So, unfortunately, when there's a problem, we always think of solutions. But prior to that, we need to think of 2 important things. What are the causes and determinants, as well as the measurement that was used to identify the cost? So I'm going to be focusing more on the causes and determinants in terms of hospitality sector and the household sector. So in terms of hospitality, what we mean here is referring to restaurants, hospitals, and schools. The problems here are related to the nature of the food menu, the portion size, which is usually large with bigger plates, the use of prepared versus whole food products, so availability, and the employee skills there. Moving to household consumption, we're talking about they're not planning meals. People just do it randomly. There's no pre-preparations. They are throwing away, again, food past its expiry date. there's reluctance. They're really hesitant to eat and even ask for leftovers from like restaurants or whatsoever. Also in the GCC and specifically Saudi Arabia, we have like a lot of big festivals, big gatherings all the time. So there's a lot of food here and there's a lot of waste happening. Going back to Thmeri's study, they found 4 household factors associated with food waste. It's very interesting. They found that people receiving social benefits or aids, actually, when people do receive it, they're going to have an increased likelihood of wasting food. So the more we help them, the more they lose the food, which is interesting. Also, household income did make a difference. So they found that people with low, so let's say below 5K or between 5 and 10K, had a lower chance of reducing food compared to the middle class. So the middle class, no, they had a higher. So we're talking between 11 to 16K. They were more likely to waste food compared to the higher, which is above 20K. Also, having an elderly family member living in the household increased the chance. All of these findings are significant. Finally, moving to the number of people. So they found that people living in a household, let's say a number of 9 or more, did have a higher impact in terms of wasting food compared to people with 2 or less living in a household. So these factors are interesting, and we need to further investigate what's happening. So now we come to solutions. We've looked at cause and determinants. Let's think of like interventions or strategies. How can we reduce food waste? We have a lot of like different institutional initiatives, let's say targeting school, higher education, hospitals, restaurants, and we need to modify the catering practices that's happening. We need to modify the consumer behavior. How do they do the grocery shopping, the shopping behaviors, as well as awareness raising through campaigns. So this is just some of the awareness campaigns happening in Saudi Arabia. Workshops, campaigns. What are the challenges? I'll finish here. So most of these programs, unfortunately, they don't have a program evaluation, a proper framework or model done for that. So this makes it difficult to check fidelity. Did it actually happen the way it should? Monitoring and the implementation. Also, sharing experiences and lessons learned is lacking. And most of these campaigns or strategies, they focused on traditional educational programs or techniques rather than new ones emerging like gamification and behavioral economics, which is going back to understanding what are the factors that makes the people choose and behave the way they are. There are numerous factors out there. Also, we have collaborating and joining efforts between private and governmental sectors. Again, this is lacking. Sorry, I was rushing so fast for the 7 minutes. Thank you for listening.
Thank you so much, Dr. Yara, for this excellent presentation. Now I would like to introduce Mr. Faisal bin Sunaid. He will talk about Saudi Arabia's nutrition policies and strategies to promote public health, paving the road to the healthy 2030. Mr. Faisal is a director of Healthy Food Department at Saudi Food and Drug Authority. He has a background in nutrition, human nutrition, and clinical nutrition. He participated in conducting many research projects and nutrition and public health. Also, he's contributed with national and international working groups like WHO, FAO, etc. Mr. Faisal, the floor is yours.
Thank you so much, Dr. Majid. Good afternoon, everyone. I don't know if you can hear me, right? This one, how does it work? Okay, on the side. Hello? Yep. Good afternoon, everyone. Thank you so much for the kind invitation from KAUST, actually, University, for such a lovely event. We're going to talk about the healthy food and how it's related to the food security here in Saudi Arabia. First of all, excuse me, I cannot stay on the podium because I feel like I'm in prison, so that's why I like to move. So if you don't mind that. So we'll talk a bit about such a lovely timeline over here that will take us like a flashback, back in the history about food security, then the current issue that we are facing right now. First of all, in the 19th and the early 19th century, I guess all of us agree that actually there was actually, no, I'm going to say there was, it was actually a kind of food insecurity until this moment. The whole world, we're facing kind of like food insecurity and a lot of, let's say, actions being taken that time in order to facilitate or to prevent such a thing in the future. Then if you'll go to the 1940s, between the 1940s and 1950s, let's say the first pre-packaged food was introduced in precisely 1943 during the World War II for the American or the US Army in order to facilitate the way of eating and make it like easier for them and they can carry it to everywhere. Then the concept of the pre-packaged food moved forward in the 1950s and it was the first pre-packaged meal introduced was a turkey in the US as a way to show the public how we can utilize the prepackaged food, how we can actually, some sort like a key to prevent the food insecurity. If you will go to the 1960s, then moving forward to the 1960s, the term came into the horizon when it comes for food safety. There is an issue of food safety, how we can make the food that we eat or we consume is safe. Then moving forward in the 1970s, a fast food came. A fast food, like a new fad, I'm gonna say it, came to the public as a way, as a convenient, fast way to get a food in 1970s. But unfortunately, during the 1970s, moving to the 1980s, another thing has emerged of a consumption of such a food that's high in, let's say, whatever, fat, sugar, saturated fat. It's actually related to kind of some sort of diseases related to nutrition. Then again, if we will go back, if we'll move forward in the new millennium, awareness campaign started in order to tackle the revolution of the food and the food technology and the science. I'm not gonna say to tackle it, no, it's a way to keep up with the food revolution. Then moving 2010, it was like a kind of global movement. I guess all of us being aware of it. A global movement when it comes to tackle the prevalence of obesity, tackle the prevalence of non-communicable diseases, which is basically related to nutrition, disease related to nutrition. Then again, the first thing in the GCC countries, the first nutrition policy, like we know that nutrition policy right now is one of the keys to actually, or one of the key to actually tackle the prevalence of obesity. And the first nutrition policy being introduced to the in the GCC countries was the nutrition fact labeling as a mandatory approach to be put on the prepackaged food as a way to actually educate the consumer. Then in 2015 or 2017, let's say the first of its kind, a way to educate the public in Saudi Arabia, we have introduced what's called a healthy food initiative. The main key or the main target of this initiative is to actually increase the food choices, the healthier food choices of the community. Then in 2018, several things happened, which is related to food security. The first thing in 2018, the granted has been actually approved by the cabinet in order to establish the food security strategy proposed by the MEWA. Then in September 2018, another strategy been introduced to the kingdom, which is the healthy food strategy as a way to integrate the goals of the food security strategy. Then, and finally, but I'm not gonna say the last, not the least, the National Nutrition Committee being established as a way to improve the nutritional status of the community. Then moving forward in 2019, a lot of nutrition policies being issued, and I will touch on that briefly in the next slides. So let's go to the first strategy, which is the food security. As you can see over here, I don't know if it's a pointer or not. Can I point? Maybe you can see it. So basically the main goal or the main goals of the food security strategy in the Kingdom of Saudi Arabia, first is to achieve a sustainable and domestic food production. Professor Chan at the beginning of the at the opening of the workshop, he mentioned a good, like the best word ever, which he said we need to provide a sustainable food production. So let's say the strategy is actually the same thing, working on the same thing, which we need to achieve a sustainable domestic food production. In addition, we need to diversify our food supply. We know, and unfortunately, 80% of our food in the Kingdom of Saudi Arabia being imported. So that's actually a huge issue. We need to work on it. And that's why we need to diversify the food supply over here. And the third thing, which is related to us as a healthy food strategy, we need to ensure access to safe and nutritious food as a way to actually achieve the food security and build. And the fourth thing, we have to build the food security resilience and institutionalize the food security at the national level. So since we're talking about the healthy food strategy, why we need a healthy food strategy? As we said from the beginning, it's a part of the food security actually goals. But we have something to put in mind. This is actually a recent report, but if you look at the previous report, almost the same numbers. So that's why I brought the final report or the recent report. The Ministry of Health has published in 2019 a report indicating almost like the biological risk factors, socioeconomic status of the community, whatever, etc. One of the data over here, one of the information available over here is showing for us actually, unfortunately, we have actually approximately 14% of the community almost having a problem with the blood pressure. The second thing, if we'll go another biological risk or another risk factor, overweight. Can you imagine more than half of the Saudi community are actually overweight? So that's actually triggers something for us as well. Unfortunately, the number over here is the same as the report 2013, the same report that which we rely on it when we actually published issued the healthy food strategy. The third thing, the blood glucose. We have a problem with the blood glucose. Most of the respondents in the survey actually saying like almost 11% has actually impaired glucose intolerance. So there's a kind of issue for us as well. If you go to anemia or hemoglobin level, almost 50% of the respondent have a problem with the hemoglobin level, which is related to nutrition as well. So basically, that's why we have actually published or issued the healthy food strategy with the main objective of, or let's say the vision of improving the nutritional status and the nutrition pattern of the community. How we can achieve, we have a mission to improve the nutritional value of the food products that we have it in the Saudi market. So that's actually one of the policies, several policies being actually issued recently, but here like an example of it. One of them, I have only 2 minutes, don't worry. The nutritional policies over here, one of the things is ban the use of partially hydrogenated oil, which is the main source of the industrially produced trans fatty acids. The second thing, the food labeling, we have actually introduced to the public a new food labeling scheme, which is basically showing the amount of the added sugar among the nutrition factors, a way to educate the consumer. In addition, targeting the bread to decrease the salt consumption among the consumer as a mandatory approach, and declaration of the calorie. And I guess most of you have visited a lot of food establishments around the kingdom, and you can see there's actually a statement or a numbers beneath the price saying the calorie amount, which is a way as we are using the nudging theory over here in order to actually make the consumer aware about the amount of calories available in each meal and how he can actually go to alternative options. In recognition, or as an international recognition for the efforts that have been done by SFDA, alhamdulillah, we received the United Nations Interagency Task Force Award as a way to recognize the efforts being done by SFDA in order to promote public health. Of course, we're going to touch on the reformation challenges over here briefly. Like, since we are issuing a lot of nutrition policies, there is actually challenges comes from the food industry. One actually over here, cost, time, and the consumer acceptability and the taste. As we said, like the National Nutrition Committee, as part of the healthy food strategy and as part of the kingdom actually a strategy to ensure the nutritional status of the community. I will be touching on one of the actually studies being conducted by the National Nutrition Committee in order to monitor the food abundance or the food security during the pandemic in 2019. This study has been actually study actually being conducted across 38 countries and Saudi Arabia one of them, and we found, alhamdulillah, overall there is actually a slight positive impact of on the pandemic on food habits as a way like the consumer going towards healthier. In addition, abundance in Saudi Arabia. Overall, I'm not working for myself. We are working for the future generation. These are actually my kids. So I'm working for them in order to improve the future generation, to get healthier, nutritious food. So basically 3 key messages we have to put in our mind. The first thing, food security means safe and nutritious food for everyone. The second thing, food security, safe, nutritious, it's the right, the absolute right for everyone. And we need to create at the end a sustainable, secured food, healthy food environment to protect our community, which basically working together, all of us, we can prevent forever. Thank you so much.
Thank you so much, Mr. Faisal. You exceeded 2 minutes, I think. Thank you so much for this fruitful, actually, presentation. Our next speaker will be Mr. Abdullah AlDakheelallah. Mr. Abdullah AlDakheelallah will talk about the risk-based approach and food risk assessment to food security and sustainability. Mr. Abdullah AlDakheelallah is a director of the Risk Assessment Department in Saudi Food and Drug Authority. He has a background in agricultural sciences, food science, human nutrition, microbiology, and biotechnology. Mr. Abdullah is experienced working with a number of government agencies such as Ministry of Environment, Water, Agriculture, and also Ministry of Municipal, Rural Affairs and Housing. Also, primarily he developed development risk-based national food monitoring plans to be conducted by the Department of Monitoring Contaminants. Also, he developed a clearance criteria for imported food, risk profiling, and also data analysis and food safety risk assessment to support decision making in Saudi Arabia. Mr. Abdullah, the floor is yours.
Thank you. Thank you, Dr. Majid. Assalamu alaikum. Thank you, KAUST. Thank you, Rebecca, for organizing this. I'm glad to be speaking to you today. Although my 30 slides presentation was shortened to 7 slides, I'll try to stick to that, although I'm known to speak for long times usually. But I'll try my best to at least give you a snapshot of what we do and how food safety actually dynamically works and intersects with food security. And that's why we're talking today about the risk-based approach and risk assessment in general within SFDA, or Saudi Food and Drug Authority. So as Faisal, my colleague, talked before me about the importance of food safety and food security briefly. Basically, we're trying to secure food, but not hazardous food, right? We're trying to secure safe food for ourselves, our population, our people, our visitors. So if we go back to the FAO definition from 1996, largely agreed upon definition of food security, it's physical and economic access to individuals to nutritious, safe, and sufficient food. And that goes, take the word safe to food safety, and then let's talk about what is food safety, basically. There's a number of routines that should be followed to avoid potential health hazards. And the responsibility of food safety lies upon government, regulators, consumers, and food industry. The government part is typically based on technical regulations, standards, microbial criteria, maximum residue limits, and so on. While consumer is responsible for safely storing the food and taking care of good preparation and cooking practices. But ultimately, the processor or the food business operator is the sole responsible for our food safety, because they control the processing facilities, the sources, and the end product. So food safety is large. So a best practice approach would be risk-based. Risk-based approach food safety, basically, or simple definition for it would be to prioritize by focusing on risk factors that may cause foodborne illness. There are many things we can focus on in food safety, but the more information we have about our situation in Saudi Arabia and our food supply, the more accurate and straightforward tackling of issues or targeting activities. Systems such as epidemiological surveillance by health authorities, hospitals, and partners in that field. Contaminants and residues monitoring programs, rapid alert systems, whether in GCC or with Europe or a global network of that. Historical data of your activities in SFDA or in the government in general, and LIMS, the Laboratory Information Management System. With those systems at hand, although there's always a chance for improvement in each one of them, you can carry activities such as risk profiling from farm to fork. You see where the gaps are, and then you put extra controls in those areas. You can do the risk ranking practice where you set your priorities, and then you can commission or start doing risk assessment, which is a systematic approach within risk analysis framework to support decision making. But risk assessment also needs consumption, food consumption surveys, total diet studies where you can actually learn the exposure to certain chemicals to your population and then make sound decisions, and you can enhance and improve your risk-based standards and technical regulations. Examples of the outcomes of these practices or the risk-based approach is the risk-based clearance. You don't want to test everything and every shipment coming to Saudi Arabia. And also risk-based inspection, where you target specific things, specific processing facilities based on your historical data and your monitoring programs. But what is risk assessment? Well, we have two main categories of risk assessment. One is chemical, which has been here in the world for very long, over 30 to 40 years. It's usually quantitative. You deal with numbers, occurrence data in your food. Concentration data is important as well. But then also the consumption. If you have consumption data, what people eat in Saudi, then you have a sound chemical risk assessment. On the other hand, you have the microbial risk assessment, which is actually more of a storytelling. You try to do predictive microbiology. You predict the course of the microbe, whether it dies over the course and along the supply chain, or it increases in number and then causes disease, and so on. We use tools for that. Of course, we need the data on occurrence, concentration, consumption, but then we use what we say Monte Carlo simulation. You try to see from 100,000 population, how many people are getting sick or falling ill for a pathogen. Using RStudio, coding in RStudio, or using an add-on tool to Excel, which is at risk to do that. Microbial can be quantitative, high, medium, low, numbers, or qualitative, high, medium, low, and so on, depending on the case. But the typical steps in risk assessment in general is hazard identification, hazard characterization, exposure assessment, and risk characterization. The challenge is exposure assessment, basically, because it's the area where it's unique for each country. The other information you can find everywhere. So what is risk assessment used for? Well, we can utilize the results of risk assessment in many areas, mainly, and affecting food security directly or indirectly, mainly in planning and developing monitoring programs, making informed risk management policies, informed risk mitigation strategies as well, developing and updating food safety regulations. And the good thing is, it's the main tool that is acceptable as a scientific evidence to international trade, SBS agreement with the WTO, and so on. Finally, to summarize, in my last half minute, so just to remind you of what I said in a brief and clear messages. Number one is risk-based and risk assessment are useful approaches to food security. How? By focusing on significance to public health. We only target something that is significant to public health. We don't test for everything. The second one is that the risk-based approach is useful for sustainable food safety routines and exercises by regulators as effective and efficient approaches. Number three, it is not sustainable for food safety and security to test everything because it's not usually effective and may disturb food trade on matters of no significance to public health. You'll be testing and stopping every shipment. You'll be testing and visiting every manufacturing plant. It doesn't work. So In terms of challenges, the main challenge is to risk assessment itself and the risk-based approach to food safety in KSA. There are many, but I have selected 3 that I feel in my daily work are causing many problems. The epidemiological surveillance data needs improvement. There are some data, but we need to work on that field. Also, government-wide laboratory information management systems and historical data. When we want to work with our partners, we find trouble giving them our data, and we find trouble taking their data. We share the data on paper, but we want to share it electronically so we can actually target and build a more sound and profound risk-based approach on the supply chain from farm to fork. And at the end, the food consumption surveys, which are challenges. We carry surveys in SFDA, but you need a representative sample from all around Saudi Arabia, and it's a challenge and does not take just SFDA. This is an area where universities or maybe other agencies can join efforts and build upon. Thank you very much.
Thank you so much, Mr. Abdullah. It's very nice presentation. I think exceeded 1 minute. It will cost you a lot. So, Mr. Bandar Alowais, he's the next speaker. Mr. Bandar, he will talk about the importance of food safety monitoring and control programs in food security. And also he will talk about the roles and achievements of the National Food Safety Monitoring and Control Program, Rapid Alert and Food Outbreaks Control in Saudi Food and Drug Authority. Mr. Bandar is the head of monitoring and food contaminant section since 2017 in the Food Monitoring and Rapid Alert Department, Saudi Food and Drug Authority. He holds master's degree in food science and technology from Queensland University, Australia, and also bachelor degree in food science and human nutrition from King Saud University. He manages and processes of designing national and targeted risk-based food monitoring plans and programs, and also coordinate its implementation. Also, he's a member at the Food Safety Committee, which include members from all governmental agencies in food chain in Saudi Arabia. Mr. Bandar, the floor is yours.
Assalamu alaikum, good afternoon, everyone. As we call ourselves in SFDA, we are the data generators. Mr. Faisal and Mr. Abdullah talked about how food safety affects food security. So this is why we do our monitoring program on a national and target scale. So my presentation will give you a brief about SFDA efforts in food control and monitoring, designing and implementation. Strategic goals. SFDA focusing on ensuring food safety through monitoring programs, applying effective methodologies, systems, and tools in control, also reducing food risk by implementing a robust risk-based, evidence-based model, also establishing and applying a clear regulatory requirements to ensure full compliance by local companies and importers with the food and feed systems. Lastly, reducing the impact of pesticides on consumer, users, and environmental by introducing means of control and tracking their effects. Monitoring programs. So what is the purpose of monitoring program? Is integrating and organizing efforts and resources in food monitoring and control operations in a scientific manner, according to a risk-based plan and statistically based to ensure the safety of food in the entire food chain. So what's the duties of this monitoring program? Is measuring the concentration of contaminants and residues in food, determine the food items that contain contaminants and residues up of the MRLs and the resources. And what do we mean by MRLs? Maximum residues limit, and determine contaminants and residues and their safety. Who plays the monitoring program? There are two big departments plan and execute this monitoring program: the risk assessment bodies and the monitoring bodies. So the risk assessment department responsible of creation the initial plan by determining food items, parameters, and the amount of samples. Also, at the end of the monitoring program, they conduct the exposure assessment. So we at the Food Monitoring and Rapid Alert Department responsible of distributing the sample collection between important and locally department based on the capacity, also supervising the implementation, do the compliance and violation of MRL, and finally we do the reporting. The plan design. The plan design consists of many factors, but most important, the risk assessment, previous results, information needing for contaminants consumption, as well as previous cases that referred to risk assessment department for scientific opinion, also official organization reports, finally food safety studies and researches. This is the workflow of the monitoring implementation. We start by preparing the implementation program for the program from the right side. Then we conduct the sampling, collecting, then sample analyzing at the labs. Then we finish up with compliance sampling results, then risk assessment, and finally preparing reports and publishing results. So I mentioned sampling. There are many sampling inclusion criteria, and these are the most important 6 of them. The data of residues, contaminants, spread and concentration, high risk and allergic food, risk assessment recommendation, also incident and outbreak of food poisoning, as well as recommendation of data capacity and highest consumed food. There are 2 types of monitoring program. We have a national on a national scale and a target monitoring program. The national consists of many food items and many parameters, whether chemical or microbial, while targeted focusing on one single item or one single parameter. And since 2012, SFDA has conducted many monitoring programs, whether national or targeted. So it's just above 30 monitoring programs. And just to give you a brief about what we did the national pesticide residues. We did also national on contaminants, targeted on acrylamide on baked products, bisphenol A in food packaging, pesticide residue also. So pesticide residue been with us since 2012. Also contaminants, artificial colorants, aflatoxin in nuts, aromatic amides in also food packaging, and imported garlic. So these are some of the monitoring programs we conducted since 2012. And these are the results we found on from national monitoring program. Luckily, the result of exceeding limit is going slightly, decreasing slightly. However, it's been in the last 4 years fluctuating, but with the cooperation with the Ministry of Agriculture and Ministry of MOMRA since 2020, the percent of exceeding limit results has decreased slightly, and this is because one of the key factor on the third strategic plan of SFDA is to monitor the food on the whole chain. So once because for example, if we monitor salmonella in chicken, SFDA used to collect the chicken from the end result or the end point. However, with the collaboration with the Ministry of Agriculture and Ministry of MOMRA, we take the sample from several steps, and this is gave us a good results. Sorry, I thought I will go 5 minutes. No. One of the achievement we've been having with dates. The percentage of dates exceeding dates went from 25% exceeding until to 6%, and this is a big achievement we've had in SFDA in the last 4 years. And this is also the national program. Just give you some quick numbers. Since 2012 and 2019, we collected more than 25,000 samples covering more than 140 items, including 18 food groups, analyzing 5 food analytical methods, and these are under 7 national programs. This is the one I talked. Since 2020, we are doing a national monitoring program in collaboration with Ministry of Agriculture and Ministry of MOMRA. And since then, we collected together almost 25,000 in compare to 25,000 SFDA by itself in almost 9 years. So this is the power of having a collaborative monitoring program between SFDA and Ministry of Agriculture and MOMRA. In 1 year, we collected almost the same amount of samples we collected in almost 9 years. This is also a quick overview about our targeted monitoring program. As I mentioned, aflatoxin, bisphenol A, these small programs. We collected more than 4,000 samples. Thank you.
Thank you so much, Mr. Bandar, on time. Thank you. The next speaker, Mr. Sultan Al-Saif. Mr. Sultan, he will talk about, give us an overview on the facts and figures on food waste in Kingdom of Saudi Arabia, and outlining some of the best global practices in food waste utilization, and shedding light on SIRC plans in collaboration with all stakeholders to manage and recycle food waste into high-value products. Mr. Sultan, he's a director of the Technical Support, Research and Development in Saudi Investment Recycling Company, SIRC. Prior to joining SIRC on 2021, served in several technical and managerial roles in SABIC, in operations, process engineering, and project management. He holds a bachelor degree in chemical engineering from the Pennsylvania State University, and he got master business administration in Johns Hopkins University. The floor is yours, Sultan.
Thanks indeed, Dr. Majid. Esteemed guests, thank you, KAUST and the CDC. It's truly my honor to be presenting this to you this afternoon. So, what I will present is truly a glimpse of what the Saudi Investment Recycling Company plans are, as well as some of the existing situations that we have here in the kingdom, and how to transform truly a problem into an opportunity. So, this is the introduction of SIRC as well as the solutions. So let's first start with an intro of the company. SIRC is a Saudi Investment Recycling Company. It's a subsidiary of the Public Investment Fund that was founded back in 2017 to incentivize the private sector, local and international, towards investment into the circular economy for jobs creation, to bring more foreign direct funds into the kingdom, as well as leverage the GDP contribution. And SIRC positions itself towards achieving the aspirations of the kingdom under the Saudi Green Initiative and the landfill diversion goals, which is 94% for municipal solid waste by the year 2035 and 82% for overall waste streams by the year 2035 as well. Now, this will include multiple solutions: recycling for the plastics, paper, etc. It would include also waste to energy and energy recovery and refuse-derived fuel production, similar to what SIRC has established only actually last month in Riyadh for the refuse-derived fuel production for the mixed wastes. The other solution which we'll be focusing on here is the composting, where we would actually transform food waste and general organic waste into compost that can go back into the loop of circular economy to produce even more high-value agricultural products. So these are the revenue streams. We don't call them waste streams. They are truly our revenue streams, because when we look into the municipal solid waste or the construction and demolition waste, medical waste, etc., all of these streams, which are well within the mandate of the company, SIRC, would be taken and leveraged from, as I said, an issue into an opportunity. And this is resembled by several examples that are currently on the ground by the company, in whether it's in the construction demolition waste of the facilities that we currently have at SIRC operating in north of Riyadh, or even in other cities in Jeddah, etc. So the coverage is widespread. So for the current waste volumes in the kingdom, there is more than 53 million tons per annum of total municipal waste that's produced. Out of that, that's total waste streams. Out of that, 30% is municipal waste. And unfortunately, out of the 30% municipal waste, which is roughly 60 million, more than 50% of that is food waste or organics. This actually poses, as I said, a challenge in treatment of these waste streams and recovery of the plastic, paper, etc. in material recovery facilities. However, it also poses an opportunity in creating higher value composting products. So the mandate is to achieve 82% landfill diversion of all of these streams by the year 2035. This is truly a great aspiration of the kingdom. However, and it's a challenging goal. However, we will not start from where others have ended. We'll not start from the beginning. We'll actually start from where others have ended, and we will learn and leverage on the experiences of multiple G20 countries and other nations, where in comparison and according to our benchmarks, we see that it took around 25 to 30 years for these countries to go from around 50% landfill diversion to around, or to complete landfill diversion. In the kingdom, currently, only 5% is being recycled. And we want to actually flip that to go into 94% landfill diversion, and this is the company contribution that we want to assist with. And there are multiple great examples in the kingdom. So if we look around this great campus here in KAUST, we see that this campus actually segregates. So this would mean we would actually have recycling for the mixed recyclables. You see the blue bin, which actually can take the recyclables. You see also another bin for the organics, which actually goes into an organic waste recycling facility by a startup here in KAUST for recycling this organic waste. So this is a model that we want to take from this specific campus here in KAUST and apply elsewhere in the kingdom. So these are the recycling loops. We have the solution would actually include going from a single bin, as I said, and applying the example that we see here in KAUST into 3 bins. 1 bin would be for the mixed waste, 1 would be for the recyclables, and the 3rd one for the organics. And what you see on the right-hand side is the organics going back into the production and compost. And on the left-hand side, you see the black and the blue bin, where the black bin would go into the energy recovery, and for the blue, it would go into the production of mixed recyclables. So the integrated municipal solid waste solution, as said, includes these 3 bins, as well as the transportation of the waste into the mixed or the recycling facilities with higher developed transportation methods with multiple compartments that will enable for the waste to remain segregated. So that's another issue. Even if you sort and you mix it, it will, after all, be, you wouldn't gain the value out of it. And after all, this will go into either composting facilities or waste to energy facilities or the alternative fuel production. So for the roadmap, which SIRC is working on in collaboration with all the governmental bodies, MIWA, MOAN, the National Center for Waste Management, and etc., we want to go from the 95% landfill situation we are at now into the 94% landfill diversion that we want to have by the year 2035. This will actually contribute towards reduction of greenhouse gases by more than 38 million tons of CO2 equivalent by avoiding these organics that may end up in the landfills, and it would decompose and it will create methane and etc. and all of these harmful environmental impacts. And this will also contribute, the energy recovery and the alternative fuel production will contribute in production of energy equivalent of more than 24 million barrels per year in the kingdom. So we actually substitute the crude burning in the kingdom into burning waste to leverage the value out of it. This will, after all, create jobs for the sector, more than 77,000 jobs, GDP contribution of more than 120 billion riyals, as well as the great environmental or positive environmental impacts we want to bring for the overall sector. Thank you.
Thank you so much, Mr. Sultan, for this nice presentation. Now we are coming to my favorite part, actually, the panel discussion. But I would like to summarize some points for you. Actually, the kind speakers talk about some challenges, which is the main aim, actually, of this session, to collect some challenges facing the decision makers and also private sector in Saudi Arabia. Dr. Yara, she talked about some programs in awareness programs, and there is no fidelity and evaluation of these programs. Also, there is no national targets and strategies for awareness for food safety and nutrition in Saudi Arabia, and in general food use in Saudi Arabia. The other presentation for Mr. Faisal. Mr. Faisal, he talked about domestic food production, the importance of domestic food production, because nearly, you said 80% of our food coming from outside Saudi Arabia, which is challenging. And my colleagues before in previous sessions talk about food supply and using and water supply and saving environment for this. Also, Mr. Faisal talked about non-communicable diseases and challenges, and he talked about some biological markers from Ministry of Health assessing the population, and talked about hypertension and non-communicable diseases in general, obesity, which is I think 40%, which is a high actually prevalence in Saudi Arabia. Also, he talked about cost, time, taste of food products, and a lots of fight with the private sector regarding changes in regulation, labeling, and all of this stuff. So would like to summarize this, and we will talk about it in panel list, inshallah, in discussion. Also, you talked about healthy food environment and the importance to change the environment in Saudi Arabia to assist healthy food in Saudi Arabia. Mr. Abdullah, he talked about risk-based approaches for risk-based standards, risk-based clearance, inspection, and you mentioned that lots of challenges with data, especially with, I think, epidemiological data. Also, about the data sharing, you have facing a lots of issues in data sharing with private sector and also with governmental sectors using primary data. I think also a lots of challenges in food consumption surveys, also to help you in risk assessment and do risk clearance, inspection, historical data, and all of this stuff, which is depends on, as I understand, on the food consumption data. And I think you mentioned a representative data for the Kingdom of Saudi Arabia is very important. So it's not representative data at the moment. Mr. Bandar, you talked a lot about the program being conducted in monitoring program. You talk about the inclusion criteria and also fluctuation of the data. What I have seen in your presentations may be challenging. Maybe it's different from sectors, governmental sectors in Saudi Arabia. But it is a success stories in reduction of pesticides in palm dates, and we don't know about other contaminants. Maybe we'll discuss further on it. Last not least, Mr. Sultan, he talked about the recycling of the waste and the separation of this waste, and we are looking forward, but it's not 30 years, inshallah, very soon, about the separation of this. And you talked about organic and solid, and maybe challenges we will discuss together about the differentiation between organic and solid wastes, maybe lots of challenges you are facing. This is just I would like to mention and summarize your presentations in this session. And now it's a time of question and discussion regarding these topics. So.
Okay, yes, first question here. Speak into the box, please, sir.
Yes, my question is to, I think Faisal bin Sunaid, yeah. It's really very interesting when you mention the children and young people. I think that's where the big impact should be, and maybe it is worthwhile to invest more. But not only that, there is another point I think maybe we should consider related to food security is King Saud University for the Health Sciences, in cooperation with the WHO. They made a big study all over Saudi Arabia, and they found that the diseases you mentioned, hypertension, diabetes, obesity, are related to early childhood, to adverse childhood experiences. So maybe if we can put some effort in this, maybe we can hit many birds with the one stone, because if you could reduce these adverse childhood experiences, we make people in their adulthood and beyond less susceptible to these diseases. And therefore, we don't limit the choices of food to them, because we know that not all people are affected by the foods you mentioned. Only small percentage, or maybe some percentage, are affected, but many people are not affected by this kind of food. So if we treat it earlier, then we make more people less affected, and therefore we expand the scope of food security. We make it easier to be food secure.
Thank you so much for the question, actually. Yes, in reply to your question, for the sake of time, we haven't mentioned actually most of the regulations have been actually issued by Saudi FDA. Yes, recently we've actually enacted some of the regulations actually imposed children in order to prevent the childhood obesity. I have to say it clinically wise, juvenile obesity is controllable more than the adulthood obesity. So if we can control the obesity at the childhood or early childhood, we could prevent in the future, inshallah, any sort of the obesity. Yes, SFDA is working on a lot of initiatives, let's say, in terms of policies in order to prevent the non-communicable to children. For example, when it's gonna become, inshallah, soon to the public, marketing to children, which I mean high food or high food content of fat and salt and sugar will be, inshallah, introduced to the public as a way to prevent any kind of marketing of these food to the kids. These were one of the regulations. The other regulations we're going to come to, which is basically some sort of requirements being set by Saudi Food and Drug Authority in order to actually control the food being targeted to kids as from age 6 months till 3 years old. Yes, I totally agree with you. We have to work on the children, of course. At the end, the overall, what we're looking for is to improve the nutritional value for the whole food products that we have in the kingdom. And one of the key things that we will have to work on, and we are working on, children, of course. Thank you so much.
Yes, another question over here. Please take the speaking box.
Thank you. Hello. Excellent presentations. Very good. I enjoyed all your presentations. I have a question for Mr. Faisal. I understand that the front of label traffic lights were recently introduced. My question is, how has that been received by consumers, and how do you evaluate the effectiveness?
Yes, you mean it as a mandatory approach?
Yes.
Yeah, we are working on it as a mandatory approach for the meantime. For the consumer, when you look at it, there is actually a study not yet being published, but there is a primary result. They liked more the color-coded labels. They preferred more than the other non-color-coded label. And they prefer more the warning labels, which I mean by the warning labels, like that's being adapted by the Latin America, and soon will be adapted in Canada. What I mean by the warning label, like a stop sign, when it comes on the food products, they preferred more. But here, in a way to harmonize the legislation or regulation across the whole region, what I mean by the region, by the GCC countries, yes, we have adapted the traffic light labeling scheme. It was actually as a voluntary approach in 2018, and now we are working on making a mandatory approach. Still, we are working on it. I guess there is a lot of fight between us and the private sector for sure. When it comes for it, we do understand it from their point of view as a way we have to educate the consumer first, in order to actually introduce this kind of labeling or this kind of information, nutrition facts. Yes, I guess it's a key factor for us. We have to aware the public on it. Aware the public when it comes as red is not that does not that mean it's not safe. And I guess all the food industry are concerned about the way that the traffic light being presented to the consumer. If you will go see, like for example, red color on the front, on the back, on the front back of any food products, when it comes to their mind, it might be dangerous. It might be unsafe. No, we are working on it. Soon, a lot of awareness campaigns will come. Recently, we've actually went to the supermarkets in Saudi Arabia, specifically Riyadh, in order to actually educate the consumer about how you can utilize front of back labeling as a way to actually alter your food choice. Thank you. I hope you answered your question.
Very good. Thank you.
Thank you.
Can I ask one more question?
We'll just see if there's another. Yeah, one more question.
This one over here.
Yeah, okay.
Okay, sorry, I forgot about the evaluation.
Yeah,
The evaluation when it comes for the food industry, there is actually a bad, and I'm not gonna say bad, sorry. They weren't actually responding to us. They don't want to actually implement it. A recent study published by the SFDA, we found almost 1.2% adopted the voluntary approach of front of back labeling. There's a huge resistance. When it comes for the consumer, I said, as you said, for the consumer, yes, evaluation being conducted, but not yet being published. Soon will be published, inshallah. The primary result, as I said for you at the beginning, it's actually kind of going for the color-coded.
Yeah, hi.
Yes.
I had a question for Sultan, I believe. So what is the status of recycling in Saudi Arabia? I mean, you know, we live in KAUST. We separate our stuff. I mean, are you guys doing the same types of things in Riyadh and Jeddah and in the cities in the country and things like that? I don't know.
Thank you.
Yeah, excellent question. So currently in the kingdom, the waste segregation is not yet a mandate, right? So it's being done as a voluntary approach by multiple compounds, by multiple facilities, campuses, similar to the example of KAUST. Now, what we're trying to make, and what we want to start actually, along with the National Center for Waste Management, who are actually the regulator of the sector, they have programs and there are also rules and legislations that are being passed to mandate the waste segregation at source. There are also plans to start this in some areas in Riyadh, and there have been some trials also in the past in 2 neighborhoods in Riyadh. However, to answer your question, as a mandate, this is yet to be done for the rest of the kingdom. But for us to achieve the landfill diversion rates and to achieve the values that we want to achieve, the source segregation is a must.
What's the implementing that in the country? Within a year, within 5 years?
See, 2025 is the target year to have these the sorting at source deployed, because this is actually the year that we want to start the let me say the diversion. Maybe in the last slide that I presented, it shows the roadmap. So our roadmap actually starts where the landfill diversion to go into. For the example of Riyadh, 70% of landfill diversion in the year 2025, and then this jumps to around 84% landfill diversion in the year 2030, and then we achieve the 94% landfill diversion in the year 2035. The same model will be applied in other regions also in the kingdom. Thank you.
Assalamu alaikum. My name is Dr. Khalid Mahmood. I'm from the UK, from Research Institute, Rothamsar Research. My question is for Dr. Majid. Just want to understand One Health in relationship in use of antibiotics, especially in livestock. Thank you.
Sorry, I didn't understand your question about antibiotics.
Antibiotics used in the livestock, in the feed or in
I think with
dairy
Mr.
or
Abdullah.
meat. Yeah, thank you.
Yeah, it works. Thank you very much for this question. As a matter of fact, in terms with the use of or utilizing use of antibiotics and their residues in food products of animal origin, their combined effort by the Public Health Authority, SFDA, and MIWA to have a control or strategically work with this issue. Because geographically it's a challenge, and then each agency is controlling a different part of the matter. So we recently finished a draft strategy with the Public Health Authority on how to control the use of antibiotics on animals for human food. Still it's not yet published, but we're working on that. SFDA works on the regulations for the antibiotics themselves, but me will work on the application of antibiotics on animals by farmers and producers, while Public Health Authority and Ministry of Health are working on the human part of it. So we're still collaboratively trying to finish up a strategy on that matter. Yeah. I hope this answers your question.
Thank you so much, Mr. Abdullah. I have a question to Mr. Sultan. Professor Rod, he asked you about the time for implementation. But with the challenges you are facing now, if you are giving us some examples relating to this to tackle these issues.
Okay. Thanks, Dr. Majid. I think this is also something that has to be discussed, and we have to shed light on this. So one of the challenges and the reason why we actually are adopting waste to energy approaches is indeed when we start the sort segregation, right? And when we start this, having the 3-bin solution of mixed recyclables, general waste, and organics, there could be some issues in the deployment in terms of the compliance and the awareness. And I'm sure we've looked into some examples of when, and the benchmarks also says that, when sort segregation started in multiple countries, the compliance percentages weren't that high in the first couple of years. This is why what we are deploying is a solution that would actually be dependent by a percentage that would be around 35% in the year 2025 at least of waste to energy. And then this would actually be taken along with the rest of the treatment mix. You confirm material recovery facilities, RDF, which is refuse-derived fuel, as well as composting. So this actually gives us this jump, the first jump, and it de-risks the issue of the compliance of the sorting at source. So this was the risk and how it was addressed in the project plan.
Thank you, Mr. Sultan. I have another question. I would like just to, because you are sharing the same issue in awareness programs. Also, Dr. Yara, in awareness programs in changing lifestyle and behavior related, because even food waste or using, for example, food loss and food waste in preparation, doing all of these things. What is the challenges you are facing, and what is the costs maybe you are facing in these matters?
So, good question. So, going back to the same program, so we need to be very specific about who's the target group. I think, as we've just spoken, children are a really very important target group, as well as females, because women are in charge of like usually handling food, and even when they have all these like festivals or gatherings, they're in charge of it. So we need to be very specific about the target group. And we need to, of course, reach everyone, but specific programs need to be targeting these specific groups. Also, we need to be working on changing the cultural perspective, where we know we need to be very generous when we have visitors. We always have to have extra food. How can we change this? It's going to take time, but we need to, honestly, it's collaborative work. It's not just through one campaign or one work. It needs to be done on a higher level. So it's, again, a partnership with private and as well as governmental. So it's, but I feel people, they are willing to listen, but we just need to make sure, how do we deliver this? Using what? It's about the techniques, behavior change techniques and things like that, not just the traditional way.
Thank you so much. Yes, please.
Thank you very much for all the beautiful, enriching presentations. Mr. Faisal, you talked about the malnutrition and about the fact that we have.
Introduce yourself, please.
Excuse me?
Introduce yourself, please.
Luay Gazaz. I am into organic foods business. So you talked about the malnutrition and about the fact that we have more than 50% of our population having malnutrition. And my question is, we would like to have natural supplementation available to the population. But the fact right now is that these natural supplementation is considered as medicine, making it very hard to import and to make available. So are there any programs, initiatives to make these supplementations more available to consumers?
Thank you so much. In response to your question, let me clarify it to everyone. There is a difference between talking about food supplement and what you said about like a drug, or I'm going to say a drug, like a therapeutic dose. So for the food supplement, yes, there is a plan, and actually soon will be implemented, about the increasing the amount of food supplements on in the country. Like soon you're going to find it maybe in the supermarket. You can buy it in the supermarket. And also when it comes for food fortification, yes, there's a recent actually policy being published by Saudi Food and Drug Authority, because we saw the number of anemia around according to the final report published by the Ministry of Health, and we started actually imposing a new, I'm not going to say a new guidelines, it's basically more updated guidelines when it comes for fortifying the wheat flour with iron in order to avoid the anemia. Yes, in response to your question, there is a plan, and we are working on the food supplement. Yes, we are working on the abundance of food supplement. Yes, Saudi Food and Drug Authority now has started to actually work with the other private sector in order to solve all the problems to, in a way, to provide for the whole consumer a food supplementation. But we have to put in our mind that a food supplement is the choice of the consumer. Okay, we need to exceed the amount of the let's say nutrients that we have to take, because at the end it might impose a certain threat to the human body. So we have to put in our mind, yeah, it has to be a combined actually effort as awareness campaigns and facilitating the process of the availability of the food supplement. I guess that's the way that we are working on right now. I hope they answer your question.
Thank you so much. Yes, I think we have 2 minutes.
2 minutes.
2 minutes to close. If you have any question, yes, please, Dr. Salim.
Okay, thank you. Really, I will mention some facts, and then you can, Majid, choose who will answer it. When we see the consumption of the people here in Saudi Arabia, we will find that sugar, we are consumed 104 grams per capita, comparing with 64 in the world. So we have not acceptable portion of sugar. When we go to the red meat, it will be the same 10, around something 10. And in OECD, it's around 40. And this is give you an example of the portion of protein that we are consumed here in Saudi Arabia is not that much. Let us go to coffee. It's 14 something gram per capita per day, compared with 4 in the world. So there is something wrong with us. I don't know what it is. I think it should be solved. There are some programs. We should work on it to solve all these issues. And when I listen for the waste, I think it's a very huge number. We have 33% of our food is lost or wasted. And we are just streaming this morning about water scarcity, water consumption. There are agriculture. Please, Dr. Tester, shouting, please stop growing dates, stop growing. And we are throwing 1/3 of our food in the past, in the waste. It's meaning that we are wasting 1/3 of our water. It's have been wasted outside. So we need to think about it. There are solutions, but we need to think about it, put it in the tables, discuss and put the solution for it. And I don't know how you will maybe look for this issue. Thank you.
Thank you so much. It's a nice actually question. The last question, really, it's shocking numbers when we see as Dr. Yara mentioned, 40 billion riyals we are wasting on food in 1 year in 2016. So it's a huge number. 33% of our food wasted. It is a really huge number. In another side, you are saying right things. Increasing production, we should increase it in a wise manner, not increase it in demand, not in demand, in what they want the population. We should change. 45 years back ago, we are not eating rice a lot. All of our food from wheat based. As we in small cities and also in villages, Jirish, Girsan, Margoog, Marasiya, all of these traditional food items being prepared at home, and the actually food being grown in Saudi Arabia, and little of them coming from Saudi Arabia. Some initiatives should be on the national level. Are we going to change the lifestyle and perceptions of our population regarding going back to what's been grown in Saudi Arabia and what is suitable for our environment? What is suitable for us in Saudi Arabia? 80% food items being imported from Saudi Arabia, outside Saudi Arabia. It is a huge number. It's a huge number, and we should let's say in a wise manner produce our food items. What is suitable for us, and it depends on universities, KAUST, King Saud University, and other universities. It depends on other research programs, initiatives to change the perceptions of the population. The culinary authority talking about other new food items suitable for us. Let us shift from rice to wheat-based food items and other food items. This is the little bit humble answer to you, Dr. Suleiman.
But we are more than 25 million.
I think, yeah.
It's not the major, you know, our time is not.
Yes, you are right. Yes, Doctor.
If I can just add, for any change, in order for any change to happen, it can't be just one organization on its own. We can't just ask from 1 or 3 or 4 universities. It has to be on top. The government supports, which is there, but we need to have all the different entities working together in alignment. This is how change, we see like an actual change. So yes.
So much. Paul, he's waiting now. Thank you so much for contribution. Yes. Yeah, thank you so much.